Endocarditis, as the term implies, is an itis, an inflammation of the endocardium. It's most often caused by an infectious agent. So a variety of microorganisms can infect the heart. The route of exposure includes ingestion, injection, and inhalation. What you're going to see in the cardiovascular system, especially with endocarditis, probably the most common source of endocarditis is a bacterial infection as a result of injection. So injection could be through intravenous drug use, or it could be through a device that a medical provider places. So there are a variety of devices that we place that hopefully are done through sterile technique, but have the complication of the possibility of infection. Viruses, fungi, and protists can also infect the heart, but it's unusual for protozoans, so that one you don't need to worry about. Fungi really don't exist in the human body as disease, except in patients who have altered immune systems or have taken medications that affect their immune system. So oftentimes with fungi, if a patient presents with a fungal infection, you worry about an altered immune system. Viruses, as you know, are ubiquitous. They're all over. And there are viruses that can infect the heart. So in infective endocarditis, the infection leads to inflammation of the endocardium. As I mentioned, it can be caused by any of the organisms that are listed, but the most common in the case of an intravenous introduction is bacteria, and the most common probably in the case of an organism that's either acquired through the respiratory tract or through mucous membranes is a virus. So the organism then damages the endocardium. These organisms are blood-borne. That means that they're transferred to the heart through the blood. And then once that pathogenesis occurs and you have that damage, it's even higher risk of additional infection or additional organisms becoming colonized there. And then you have proliferation, and sometimes that proliferation can lead to what are called vegetations, which are growths often on the heart valves. The classic findings in a patient with infective endocarditis are fever. It is a systemic disease in the sense that the bacteria get to the heart through the bloodstream, and the bacteria can be released into the bloodstream from the site of the endocarditis. You may see a new or a changed cardiac murmur because one of the areas of the heart that's most at risk is the valves. And when the valves become infected and those vegetations occur, those are masses that are on the valve that affect the valve's function. And when the valve is not functioning right, you hear a murmur, which is turbulent blood flow through the valve. You can see petechiae, which are little blood spots under the skin in the conjunctiva and in the oral mucosa. Those are little microemboli that come off of the vegetation and then travel through the bloodstream. The characteristic physical findings, osseous nodes and Janeway lesions, you don't need to remember those, but just know that they're pretty specific to endocarditis. Others that are common are related to the fact that it's a systemic disease, so you can have weight loss, back pain, night sweats, and if the endocarditis gets bad enough or a valve is affected to a significant degree, it can lead to heart failure. So here are the clinical features, but you can see here subconjunctival hemorrhage. So you can see that there's a lot of additional blood there. There's a spot right there in particular that's pretty evident. Different kinds of murmurs that can occur. The osseous nodes that I mentioned, petechiae that look like this, and those are little microemboli that are often the result of endocarditis. And You can get hematuria because some of those microemboli will then travel down the aorta and into the renal artery and enter the renal parenchyma and cause little infections even within the kidney. Less often the infection, but more often the same phenomenon that you're seeing in the petechial rash, where you get these little microemboli. Poor dentition is often a risk factor, not really a complication. Can be a source of seeding the blood. So that's another way that the organisms can get from the mouth into the bloodstream and then end up infecting the heart. This is another cause and effect diagram right out of your textbook, but it starts with the pathophysiology of endocarditis. And you can see that there are some other risk factors that we haven't mentioned, such as congenital heart disease. So someone with pre-existing congenital heart disease is at higher risk. Somebody who already has valvular heart disease is at risk. Trauma from a procedure that actually injures the endocardium or the heart, and then the presence of a prosthetic valve. All of these things put you at higher risk for endocarditis. But we also talked about the introduction of bacteria through the use of intravenous drugs. So intravenous drug abuse can be a factor. Poor dentition, other things that are going to introduce bacteria into the blood supply. There's some endocardial damage that occurs that has inflammation and thrombus formation, and then things progress from there. You can see here, I mentioned some of these other risk factors, but you see injection drug abuse, indwelling catheters. If you have a wound that's not healing, or you have poor dentition or other procedures, those can all introduce bacteria into the blood.